Stunting is a phenomenon where children are too short for their age, and it's one of the key indicators used to measure malnutrition in the Sustainable Development Goals that we're using to track kind of improvements in health around the world. So at a recent conference at the London School of Economics, we sat down with experts and asked them how their research on stunting was helping us to understand this phenomenon.
Stunting, chronic undernutrition, is indeed a global problem, affecting maybe 1 child in 3 under the age of 5. We know chronic undernutrition really matters. Children who are chronically undernourished do less well in school. Because they do less well in school, they don't get jobs which are as good as they could be if they had not been stunted. Unfortunately, we don't have really good ideas about what will prevent stunting in early life. But one promising area of research is to pay much more careful attention to the quality of children's diets. That is, not worry so much about the energy content, the calories, but more about the content in terms of animal source foods, of protein and choline.
Traditionally, stunting has occurred in low and middle income countries in the lowest, most resource poor individuals. And what we're seeing now is that stunting is co-occurring with child overweight. So we have what is called the dual burden of under and overnutrition. That is, children who are stunted but perhaps overweight, either in the same population, within households, or even within individuals, so that we can have stunted children with linear growth deficits, but their weight gain is high and they're ending up overweight and obesity early in infancy. So this creates major challenges for healthcare providers because they have to deal not only with the continuing problem of stunting, but also now with overweight and obesity, which we know has very important long-term health consequences for both children and adults.
So one of the things I've learned in the last couple of years is that stunting is actually a part of a larger growth pattern, and changes in stunting are related to changes in the growth pattern. So if we look at history, the growth pattern of children has changed quite considerably over the last 100 years. Children are less stunted at early ages, but they also now experience an earlier pubertal growth spurt, and the velocity of their growth is higher across the growing years. And so what I've been trying to do is look at data in Japan and the UK to try to understand when these changes took place precisely and what factors might have been causing them. And what we found is that there are lots of factors that seem to be important, and we're going to try to pin down some more in the future.